Hi, this is Dr. Bradford Kolb of HRC Fertility, and I'm really excited to be here with Brenda Strong. Brenda has been a dear friend of mine for the last 15 years, and I'm so honored to have her here with us. It's something that I've looked forward to in this conversation. So welcome, Brenda.
Thank you so much, Brad. When you said 15 years, I was like, wow, has it been that long? But I realized that, I was the national spokesperson for the American Fertility Association for at least 10 of those 15 years. So that makes perfect sense.
Yeah, so I think we met in about 2005 when my wife Judy was on the board for the American Fertility Association, and Brenda was a very generous national spokesperson for the organization and gave just enormous amounts of time and her expertise towards the organization. So Brenda, you've been involved in reproductive medicine and women's health care for many years. This is not something new to you, and I just so admire everything that you've done. I have to say, I did sneak on wiki pages and just to look at your history a little bit, and I'm so amazed at your film credits, both in television and film. And then on top of that, somehow you have the ability to put together strong for yoga, different components with women's health care and fertility. So I'm just so admire everything that you've done, and you look so great and healthy despite all of this hard work.
Thank you. Thank you. Yeah, I've been doing this for quite some time. The irony is that both my yoga and my acting career has kind of come up together. And initially, I loved doing yoga because it was very centering for me as an actor for my career. And it kept me healthy and grounded. And as an actor, your body is your instrument. So it was a bit of a surprise to me that it ended up actually becoming a tool to help my own struggles with fertility. Back in 1998, I started working with the Mind Body Institute at UCLA because I had been a yoga teacher since I was pregnant with my son. And I found that yoga was a perfect pairing for helping couples kind of figure out how to calm their own nervous system and access a place of centering and balance. And that education of using it to help heal my own secondary infertility really became kind of the platform that ended up being the foundation for strong yoga for fertility, strong yoga for partners, strong yoga for pregnancy. And it ended up becoming this kind of second career where I really deeply cared about helping couples conceive healthfully and through education and through beautiful kind of collaborative relationships with HRC and other RE clinics. So.
Well, thank you. I love the personal aspect of this because it really brings it to life for you and for our patients across the whole field of reproductive medicine. So yeah, that's it. That's a very unique perspective. And I have to say, for the audience that's listening here, as a fertility specialist, and many of the doctors in this field were very ingrained in the science of reproductive medicine, of Western concepts, and we're pretty busy people. And so often we're not always promoting alternative therapies, Eastern therapies such as yoga, herbal therapies, and acupuncture as part of our patients' care. And our patients often, I find that they don't share that stress with us. They kind of hold it. Sometimes they'll share it with the nurses, but it's something that as a traditional physician in reproductive medicine that we need to be more cognizant of those emotional needs of our patients, not only for them to have peace of mind going through their journey, but look at ways that they might use this to improve their overall conception rates and healthy pregnancies.
I'm so proud of you for embracing that kind of complementary medicine approach, because there's a lot of people out there that they only see what they know, and you have a wealth of knowledge that has helped so many couples conceive. But you're right, it is a mind, body, and emotional process conceiving. it's not just science. There's a whole host of lifestyle choices that contribute to couples' ability to be more successful or not. And I have over the years, the many years that I've been doing this, found that it's the pairing of the two that really helps create the most success. And what I found more than anything is if you can, through mindfulness techniques, through education on nutrition and environmental toxicities, and if you can learn to manage your own sense of health in your life as you go through ART, then it just gives you a more successful opportunity to continue down the path until you're successful. What I find is people usually come to me when they're at their, wit's end. They've done 8 IVFs and they have, 1 egg left, and they're just, they're hoping. And the truth is, if they start earlier with these techniques, they are so much more calm in the process and so much more available to listening to your information and being just more relaxed about the process, because they know it's a journey, that it's not just about getting that pregnancy the first time, but it's about, okay, well, that didn't work this time. Let's try this next time. And it just gives them a sense of security to know that they can manage their emotions during that process.
So Brenda, I agree with you completely. And I would actually suggest to anybody that's watching this, don't wait till you're in the midst of your treatments. I would encourage you to start before you start any treatments. If you haven't even scheduled a consultation, I think it's really critical that you look at ways to ground yourself, ground both your mental health as well as your physical health before you start conception. Because many of these lifestyle changes takes months to incorporate and improve your health. And that's when you're going to see that real benefit is down the line. So this is not a quick fix. This is really a lifestyle change, as you're saying.
Exactly. And, the 4 fields of fertility, which was the initial course that I taught for several years, that became the foundation for this new program that you're working with, Soulful Conceptions. We really understood that these are lifestyle choices of nutrition, of mindfulness, of knowing what the effects of environmental toxins are on you, on processing your emotions, because anytime you suppress emotions in the body, it has a physiological impact. It's connected deeply to hormonal balance. And so, the endocrine system's very fragile, and the more people can approach their lifestyle prior to starting to work with you, the more opportunity they're going to have to be successful. Go ahead.
Yes, I want to take off on that for a minute, because when I was young in this field, I was very focused, get people pregnant. And really over the last several years, my focus has changed. Like, how do we create healthy families? That means a healthy parent, a healthy baby. And, I started learning more about the different sciences of yoga, stress reduction. Not only does some of these things alter the way our endocrine system works, but so many different factors, stress hormones, and the overall health of the body. There's an interesting science called epigenetics, which is how genes are turned on and off in the body. And I'm really a strong believer that a person going into conception and having a child, if they can optimize their health before they get pregnant, that's going to give them the best chance of having that healthy child. So that includes, so Brenda, I've been talking a lot about stress reduction in life, getting in a good place with your partner moving forward, healthy diets, physical activity, getting out of that sedentary lifestyle, appropriate amounts of sleep and rest. And I just think that the yoga aspect of this fits so beautifully into this whole concept of creating healthy babies.
I couldn't agree with you more. And I'm just so happy that the science is now meeting what we feel we've known for all this time, which is, if you can become a healthy human being yourself, then you are guaranteed a healthier child. And as you learn these stress modification techniques, you're actually able to become a better parent as well. Because as you know, the father of three three beautiful daughters. You know, parenting is not stressful. So it's not like all of a sudden your stress is going to go away when that baby arrives. And I'm sure, you know, many of your patients can attest to the fact that when they have these practices in place that are just part of their natural approach to their life, it makes becoming a parent so much easier and so much more joyful.
It really does. And this is part of life. This is a journey, and you have to look at it as such. This is not just come into the doctor's office, get pregnant, you move forward. This is how you set up your family and your child for success and really good health moving forward. And that's what the program Soulful Conceptions at HRC that we've launched is designed to do. And so, Brenda, do you want to share how you've contributed to that and how you're helping our patients?
So thank you for that introduction to Soulful Conceptions. I couldn't be more proud of the two leaders of this organization, Dr. Deborah Anderson and Wendy Obstler, both of which have been colleagues of mine. And they actually had originally been students of mine. They were yoga students of mine and then became my lead teachers of my Strong Yoga for Fertility program. So they have incorporated my fertility ball methods, my breathe to conceive methods, the yoga for fertility basic outline that I had developed while I was kind of putting together why yoga was such a perfect application for fertility struggles to help open up the hips and deepen your breath and your connection to yourself while you're trying to conceive. And they have created an online program that they have so generously offered to your patients so that patients can start to learn these techniques without the pressure of any financial commitment and get ready to come into your office and go through procedures.
So Brenda, so once patients have completed their initial consultation, they're able to access the program, but can you give me a little bit more details as to what patients can access and the benefits of the program?
Sure. Well, once they've seen an HRC physician, then they receive 4 exclusive free months of access to the Soulful Conception site. And that includes being a member and part of the community. You get to have 25 hours of access to yoga, meditation, breathing techniques, all the soulful concepts and well-being right at your fingertips. And it's audio and written materials. So it's like going to a preconception school, as it were, in order to prepare you for your journey ahead.
Well, I love that approach. It's, it begins before your treatment and your experience with HRC. So I encourage everybody that's watching this to sign on, check out the program. You could find it at havingbabies.com/fertility. /yoga offer. It's easy to find on the website, but there's just so many wonderful components to this to help keep you engaged in your journey and make it a more pleasant experience. So thank you for all that you've done in bringing us to HRC fertility and our patients.
And if anyone wants to go online to just check out Soulful Conceptions, it's right there underneath your face, soulfulconceptions.com. And one of the beautiful things about this program, in addition to all the tools they'll give you, is they have a wonderful community of people who are going through the exact same thing you are. And so there's this safe space to connect to others, to understand that you're not alone in this. And that's part of the emotional sharing process that starts to kind of destigmatize the shame that's so often associated with having fertility challenges.
I really appreciate that. It's because too many patients, they're silent in this journey, and they often do feel alone. They don't feel that they can share this. So thank you in that regard to bring that up. And really, I look forward to working with the program in more detail with our patients. I look forward to seeing you again sometime soon, I hope.
I hope so. I hope so. And you have helped so many of my friends conceive, and I am enjoying those children so much. I know we can't speak about who they are here, but you have added to my community in such a beautiful way by helping those families expand. So thank you.
It's a wonderful journey to be on. So I'm blessed every day of my life that I get to do this, and I know you feel the same way with the help that you're bringing your patients as well. So once again, I do encourage potential patients to check this out. Brenda's program can be accessed globally, worldwide, for HRC patients, non-HRC fertility patients. And for HRC fertility patients or those looking to work with us, our footprint covers all of Southern California. So we have many great doctors to work with in centers that are close to you. So we look forward to working together and helping you complete your journey to having that family you deserve. Thank you. And thank you, Brenda, for everything that you do.
Thank you so much for taking the lead on this, Dr. Kolb.
Thank you.